The nurse washes her hands and puts on clean gloves. She helps the client into a comfortable position, either sitting or lying, with his head tilted slightly back and to the left. Using the moistened cotton balls, she cleanses his left eyelid of any crusts or drainage, starting at the inner canthus and wiping toward the outer canthus to prevent the transfer of infectious organisms to the other eye. She then instructs the client to look up toward the ceiling and gives him a dry, absorbent sponge. She exposes the lower conjunctival sac by drawing down the skin over the client's cheekbone. She approaches the eye from the left side and instills the prescribed number of drops onto the outer third of the lower conjunctival sac, making sure to hold the dropper tip about a half an inch, that's a little more than a centimeter, above the sac, making sure it touches none of the eye structures. Then she asks the client to close his eyes gently and press firmly on the nasolacrimal duct with the dry sponge to keep the medication from flowing down the duct and into the nasal and pharyngeal passages. This is especially important for medications that can cause systemic effects. If this had been an eye ointment, the nurse would have held the applicator above the lower lid margin and applied a thin stream of ointment along the conjunctival sac, from the inner canthus to the outer canthus. She then would have instructed the client to close his eyes and gently massage the lid in a circular motion with the sponge, if not contraindicated, to help distribute the medication. Following an ophthalmic installation, discard your gloves, wash your hands, and document the procedure. Also, evaluate and record how the client tolerated the procedure, as well as the client's response to the medication, including therapeutic as well as adverse effects. When teaching clients to administer eye medications to themselves or others, remind them to wash their hands thoroughly before and after the procedure. Then instruct them to use a separate towel or tissue for each eye if only one eye is infected. Avoid sharing face towels or tissues with other household members. Store eye medications away from direct heat and freezing temperatures. Cap medications tightly. Discard old, cloudy, or discolored ophthalmic solutions. Discard unused eye medications once the treatment regimen is completed, and report any problems to the provider. Otic installation of medications is a form of topical administration used primarily to treat ear infections, to relieve pain, and to soften earwax prior to removal. Liquid otic preparations are instilled into the external auditory canal of the ear from a squeeze bottle or a dropper. Otic medications are administered to reduce inflammation of the ear, treat ear bacterial or fungal ear infections, relieve pain, and soften earwax prior to removal. And earwax isn't the only thing an otic installation might be prescribed to help remove. It is not unusual for insects to become trapped in the ear canal. Often a few drops of mineral oil are instilled to smother the insect and facilitate removal. An important consideration when administering otic medications is the condition of the tympanic membrane. If it has been perforated, surgical asepsis is essential to avoid introducing any pathogens into the tissues and structures of the middle and inner ear. Otherwise, medical asepsis is sufficient for this procedure. Be sure to wear gloves if the client has an ear infection. Because the path of the external auditory canal varies with age, your technique in positioning the external ear for installation is crucial. In an adult, the external auditory canal is S-shaped and about an inch long. That's about 2.5 centimeters. When administering eardrops to an adult, you'll pull the pinna up and back to allow the medication to flow through the canal. In infants and children under the age of 3 years, the external canal is straight and is directed upward, so you'll pull the pinna down and back. A few other basics. To keep from contaminating the remaining ear solution, do not touch any part of the ear or canal with the dropper tip. Also, always instill eardrops along the side of the external auditory canal. If you drop or squirt ear medication directly onto the tympanic membrane, you could damage it and cause pain. Before you administer otic drops to a client, follow the same initial steps as you would for any medication administration. Screen the client for allergies to the medication. Explain the procedure along with what to expect during administration, the desired effects, and the possible adverse effects of the drug. Make sure you are administering the prescribed amount and strength of the drug to the right client by the right route at the right time. Be careful to determine whether the medication is to be instilled in one or both ears. Cross-check the medication container with the medication order and check the drug's expiration date. Be absolutely certain that the medication you are about to administer is an otic preparation. Also be sure that it is warmed to body temperature. Otic instillation of fluids at extreme temperatures can cause vertigo, dizziness, nausea, and pain. Prior to the procedure, assess the condition of the client's ears. Check the pinna for signs of inflammation or injury, and note any discharge or drainage. Observe any drainage for amount, color, odor, pus, or blood. Use a light source to examine the condition of the external canal and the tympanic membrane. Ask if the client is experiencing any discomfort, ear pain, or loss of hearing. If the client has an ear infection, check for elevated temperature, nausea, vomiting, headache, and malaise. Document your findings, compare your assessment with the client's baseline, and report any new deviations to the provider. You'll plan to position the client either lying on the unaffected side or sitting with her head tilted to one side with the ear you plan to treat facing upward. Rest the hand that is holding the dropper gently against the client's head. This stabilizes your hand and ensures that your hand will move with the client if she moves suddenly. This simple precaution reduces the risk of striking the client's ear or inserting the dropper too far and injuring the client. Finally, make sure the client is able to cooperate during the procedure. A confused client or a small child could move suddenly and cause injury or contamination. Make sure help is available if you anticipate any potential need for it. Now let's go ahead and demonstrate the installation of an otic antibiotic to an adult client's right ear with an intact tympanic membrane. We'll assume the nurse has verified the client's identity, screened the client for allergies, and explained the procedure and its effects. She has also checked the medication record for the appropriate drug, dosage, strength, route, and time, and has checked the container's expiration date. She has also verified that the medication is an otic preparation prescribed for the right ear only. She then assembles her equipment. She will need the medication container, clean gloves, moistened cotton-tipped applicators, and cotton fluff. The nurse washes her hands and puts on clean gloves. With the client lying on her unaffected side, the nurse uses the moistened cotton-tipped applicators to cleanse the external ear structures of any crust or drainage to keep it from being washed into the ear canal with the medication. Next, she administers the warm solution by pulling the client's pinna up and back, holding the dropper tip about ½ an inch, that's a little more than a centimeter, above the external canal, making sure it touches none of the ear structures. She then instills the correct number of drops, angling the dropper so that the drops enter along the side of the ear canal. She holds the ear in the straightening position while observing the drops flowing into the ear canal. She then presses gently on the tragus, the portion of cartilage that projects just in front of the external meatus of the ear canal. This action helps the medication flow into the ear canal. After the client remains in the side-lying position for at least 5 minutes, the nurse inserts a small piece of cotton fluff loosely just inside the meatus, not pressed into the canal, to be left in place for about 15 to 20 minutes. Following an otic installation, discard your gloves, wash your hands, and document the procedure. Also evaluate and record how the client tolerated the procedure, as well as the client's response to the medication, including therapeutic as well as adverse effects. Nasal installation of medications is a form of topical administration, a route used most often for rapid absorption of certain medications, either for their local or systemic effects. Drug uptake by the intranasal route is especially fast because the upper portion of the nasal passages is lined with mucous membranes that are richly supplied by a network of tiny blood vessels. Medications given by the nasal route include decongestants to reduce nasal and sinus congestion, saline solutions to loosen secretions and help clear nasal passages, antiseptics to treat local conditions, corticosteroids to reduce inflammation from nasal polyps or allergic conditions, anesthetic agents to ease the discomfort of transnasal examinations and treatments, a mast cell stabilizer to treat asthma, and a nasal mist influenza vaccine. Nasal sprays are often self-administered, as it is easier for the client to control the timing of inhalation, which should be done as the spray enters the nasal passages. When a client is using these preparations, it is important to assess the nasal passages for signs of irritation and to evaluate the client's ability to administer the nasal spray effectively. When you are preparing to administer nasal drops to a client, follow the same initial steps as you would for any medication administration. Screen the client for allergies to the medication, explain the procedure along with what to expect during administration, the desired effects, and the